Okay, this is the female reproductive system. For those of you who followed, so far we've already done the male reproductive system, and it's a little bit more complicated than the female, and you'll see that in a few seconds. So the ovaries are the female gonads. They produce a gamete, which is the egg or ova. And like the male, they'll also produce female sex hormones. They are going to produce estrogen and progesterone. And then there's going to be a few simple ducts that are going to lead into where we talk about the female parts. So the uterine tubes, the uterus, and the vagina are all going to be the tubes that are going to make up the female reproductive anatomy. There is going to be external genitalia, similar to the male's external genitalia, and then the internal genitalia, that would be inside the pelvic cavity. They are the ovaries, the uterine tube, the uterus, and the vagina. So this is a mid-sagittal view of looking at a female, and I'm going to start at the bottom and work my way up towards here. So there is going to be an outer lip. That is called the labia majora. They have it as labia majus. If you want to do it in Latin, that's fine. Inside of the labia majora is going to be the labia minora. That is the inner lips. The outer lips, usually after puberty, will have hair there, and the inner lips will not. As we're working our way inside here, the opening here is going to be the opening to the vagina. They have it listed as the hymen. The hymen is a mucus covering that on most girls is no longer intact. If you ride a bicycle, if you do anything athletic, that mucus will probably rip. And sadly, you now have a perforation there. The bad thing about that is any bacteria that might be located here can now get inside of the vagina. Well, the vagina has a way of compensating that, and so the vagina, which is the tube that starts here at the opening and goes to about here, is going to be about 4 inches in length. Inside of it, the mucosa is made of stratified squamous epithelium, and as you look at this picture here, these are actually called rugae. The same name that we have for the bladder and for the stomach. These rugae give the ability of the vagina to stretch to accommodate whatever might be coming in or going out of there. Once we get to here, this part here is the cervix. The cervix is going to have glands, and I'll get to them shortly, that are going to make sure that bacteria doesn't get inside of the uterus here. So these cervical glands are going to be making sure that the blockage is going into the uterus. On either side of the cervix sticking out is a fornix. And so the fornix is just kind of, you want to think of it as the vagina going on either side of the cervix. That's a good way of thinking about it. But there's going to be a posterior and an anterior fornix on either side, because remember, this is going to be a circular thing. And then the cervical area will be in there. So when they're talking about someone with cervical cancer, this is the area that they would be talking about, not necessarily your neck. And so the womb, for all practical purposes, is the uterus. And the opening in here is where the egg coming from the ovary would go into the uterus, and then it would be embedded in the wall. So they're going to have 3 layers there. The first layer here, I'll show you in another picture, is going to be the endometrium. Then the muscular layer, which is of smooth muscle, is called the myometrium. And then there'll be an outer layer. So all of that there is going to be connected to the vagina. And so if you think about what we were talking about, that the male copulatory organ goes into here, and when they ejaculate, the female's body is designed to kill off the sperm. So as it can, at certain times, if it gets past the mucus here, the sperm can, if he's a good Michael Phelps swimmer, make it all the way down into here, and somewhere after the egg has been released through this apparatus here, if the egg matches up with the sperm, you can have a new baby, or you can have a baby. So if you look at this here, and going back to where we started, here is the labia majora, here's the labia minora. There is this little gland here, which is called the greater vestibular gland, but it's also called the Bartholin gland. So as it secretes its stuff, it's going to lubricate the inside of the vagina so that if there is penetration, it is going to have a mucus covering. The same thing that we had with the Cowper's glands with the mucus covering around the penis. Up anterior here is going to be the clitoris. The clitoris is an erectile tissue, the same thing or the same way that the penis would have an erectile tissue. So the clitoris is also going to have a hood on it, and we'll get to that in a few minutes. So as you're going from anterior to posterior, there is going to be the clitoris, then there's going to be the urethra. So here is the bladder, and here is the urethral opening for a female. A little bit posterior is going to be the hole for the vagina, and a little bit posterior to that is going to be the anus. So you're going from front to back, it's going to be the hole here is the pee hole, here is the baby hole, and here is the poo hole, if you want to remember how it works. So those are going to be some of the components along with, and we'll show you this in another view, here is going to be the ovary, here is going to be the fimbria. I think the fimbria looks like a catcher's mitt. So as the egg is released, it's getting caught by the fimbria, and then this tube, which is going to go to the uterine tube, which is also called the fallopian tube, which is also called the oviduct, will then go into the uterus there. So there's going to be a lot of ligaments that are holding the ovaries in place. And believe it or not, if you've had multiple births, these ligaments, like any ligament in the body, can stretch. So specifically, the broad ligament and the suspensory ligament will support the uterine tubes, the uterus, and the vagina. Nobody wants to think about that. Sometimes this thing can drop out. And so sometimes you can have the ovary drop through the vagina, as you can see in this picture here. So here's the vaginal opening here. Here is the fornix on either side. It's called the lateral fornix. Here is the cervix right here. And the opening here at the beginning of the cervix is called the external os, OS. And then as you get into the ovary, the inside portion is called the internal os. And then that would be the cervical canal. So you'd have the vaginal opening going to the external os, into the cervical canal, the internal os, and then you would have the inside or the lumen of the uterus. If you're just looking at this picture here, the rounded bump area is called the fundus of the uterus, the same thing that we had as the fundus of the stomach. So on this one here, this ovary here is kind of giving you a sequence of what's going to happen once a month. Every month you're going to let an egg be released, that's what they're showing here, get caught by the catcher's mitt, if you want to think of the fimbria as that. It's going to catch the egg. The egg will then go through the infundibulum and then through the ampulla, or excuse me, the isthmus of the uterine tube, and then down the uterine tube. The isthmus is going to be the narrowing portion here, and then here is where the egg would be embedded. If the sperm can swim through there, get released through the mucus that's going to be here, and get into here and hook up with the egg, you potentially could have a baby. But if you look at this particular one, you can see the round ligament. There's also other ligaments that are kind of holding these things in place. You really don't want to have them falling down. So what would happen in a prolapsed uterus, this portion would fall into the vagina. And so you can, I'll show you another picture that's a little bit better than that. The ovarian cycle is going to take an oocyte, which is an oocyte that is going to be 1 cell thick, and then it's going to have and go into a whole ovarian cycle. Here is a picture of what we're talking about. So in this one here, these cells are going to be primary follicles, but as they develop, they're going to have a layer going around it, and then it's now called a secondary follicle. And some of these are secondary follicles, and as we go around them, they are going to increase in size and development. So here is some of the things that they're talking about, the same picture that I showed you before. Each month, these ovaries are going to release an egg, and it usually switches from one side to the other side. So if they could autopsy one of these and you're 10 years that you've ovulated, there would be scar tissues on the inside of that. As you go around the cycle, so here is kind of showing this primary follicle, primordial follicle, secondary follicle. Eventually it's going to get to what I think looks like a happy clown's face. And so if you see the smile there on the clown's face, that's called an antrum. And here is the egg. As the egg is ready to be released, it is called ovulation. And so all of this fluid here is now going to be released. And as the fluid is being released, so is the egg. So it's kind of the old saying of, you don't want to pull out the plug and have the baby go out with the bathwater. Just kind of a weird way to think of it. So when ovulation occurs, this antrum is going to release the egg, which is this little egg here. It's going to get caught by the fimbria, which will go into this narrow channel, which is the infundibulum, into the ampulla, into the isthmus of the ovary, and then it will finally be embedded into the ovarian wall, the endometrium specifically. The myometrium is the smooth muscle on either side, and then deep or lateral to that would be the parametrium. That's what's kind of holding everything in place. If there's something called an ectoptic pregnancy, what that means is the oocyte has been fertilized in the peritoneal cavity, or the distal uterine tubes will begin to develop there. So if we go back to our picture here, so let's say the egg was released, caught here, and it ended up here. And you had a Michael Phelps sperm being able to reach it here, but it's not embedded into the wall of the endometrium. You now have something called an ectoptic pregnancy. Usually with an ectoptic pregnancy, there is going to be a natural abortion. So there'll be a lot of bleeding. And so with that, although you may have all of the symptoms of having a baby, the baby has not developed because it hasn't been in the uterus or the womb. And so a lot of times they could end up having the sperm impregnated somewhere in here or in some area that it wouldn't have an ability to be nourished and retained in the uterine wall. Uterus itself is a hollow, thick-walled muscular organ that will receive, retain, and nourish the fertilized ovum if it makes it that far. The cervix itself is a narrowed neck that projects into the vagina. That's why it has that little thing going all around it. And the cervical canal communicates with it through the external os, and then the uterine would be the internal os. Right around the cervical canal are cervical glands that secrete mucus that block sperm from entry during mid-cycle. So if you want to think of it that way, going back to this picture, the cervical mucus is going to fill this whole cervical canal except during mid-cycle. So if the sperm gets through the vagina and makes it out of the male body, this is all going to have an acid mantle that will kill anything. Mostly it's referring to bacteria. If the sperm is able to swim through this mucus, and so at mid-cycle it's usually the thinnest mucus, kind of get through there, and he's kind of floating around here. That's why ejaculation is not one sperm, it might be 250 million sperm. They're really tiny. So the egg comes down during ovulation, and it's landed here, and you have a good swimmer who has matched up with the egg, and essentially you'll be making a baby. Cervical cancer, a lot of people have heard about that, and like 500,000 women worldwide will get killed from it. It's most common between 30 and 50. The risks are frequent cervical inflammation, sexually transmitted infections, multiple pregnancies, and you should probably get a pap smear. And it says there every 2 years from 21 to 30, every year after 30, and discontinue at 65 if it's been negative for about 10 years. They don't usually change that too much, so the pap smears is inconclusive, but it's testing for human papillomavirus causes most of the cervical cancers. They are now recommending for girls between the ages of 11 and 12 to get 3 different types of vaccine to help protect them against HPV, which is human papillomavirus. We're not going to do any of that, but so it's going to be supported. The layers of the uterus are going to be threefold. The inner one is going to be the endometrium. That is the one that the egg would then burrow into it, and then, you know, the sperm has a potential of landing in that mucosal lining. The myometrium, which is the smooth muscle lateral to that, is kind of the interlacing layers of smooth muscle. That is where a woman who is pregnant is going to have that stretch. And then the perimetrium is going to be the visceral peritoneum holding it all together. The endometrium has 2 layers. It has a basal layer, which is the base layer, and then it has a functional layer. The base layer, or the stratum basalis, is going to be unresponsive to ovarian hormones. What that means is during ovulation, the stratum functionalis is going to be shed during menstruation. So we don't even have a great picture of that, but as you look at this thing here, this area here is going to be the basal layer. This top layer here, all of these blood vessels are going to be shed. So the blood that happens during menstruation is actually real blood. I've had students over the years say, is it different than blood if you cut your fingers? Nope, it's still the same blood. There's not a different canister waiting for that to happen. So during menstruation, what will happen is this top layer, or as it says here, the functional layer, is going to be shed. It responds to the ovarian hormone cycles, and it's shed during menstruation. And it's going to come out through the vaginal area and out into the real world, I guess you could say. So the vagina is basically a thin wall, about 8 to 10 centimeters. That's about 4 inches. It is also the birth canal. It's the organ of copulation, where the penis was the organ of copulation for the male. The vagina is the organ of copulation for the female. It extends between the bladder and the rectum from cervix to the exterior. And the urethra parallels course anteriorly, and it's embedded in the anterior wall. So here is a good picture of what we're talking about. So here's the mons pubis. It is basically fat covering over your pubic bones. Then you can see out here the labia majora. And then there would be this portion here is the labia minora, which is going to be the minor labor, minor lips. Inside of this would be the clitoris. Remember, that's the erectile gland. And here it is called the glans. It's the clitoris. Then as you work your way posteriorly, this opening here is the external urethral opening for urine to come out. And then in this particular one, the hymen has been ruptured. And like I said, most girls in the United States have ruptured their hymens just from athletic activity. You can see the opening of the greater vestibular glands, and so they're going to secrete the mucus into that vaginal area. And as you work your way posterior, there's going to be the anus. So basically, if you look at this whole bottom of a female, it's all designed for protection of the opening going into the vagina. The mons pubis, as I just mentioned, is a fatty area overlying the pubic symphysis. The labia majora is going to be the hair-covered fatty folds that are the counterpart to a male scrotum. The labia minora is the folds lying within the labia majora, and they are going to not usually have any hair on them, but they're going to make sure that anything that's interior to that are going to be protected from bacteria. The greater vestibular glands are going to flank the vaginal opening, and they say here it's homologous to the bulbourethral glands, and they're going to release a mucus into the vestibule for lubrication, similar to what the bulbourethral glands do in the male. It's going to lubricate the glans penis for lubrication. Clitoris is anterior to the vestibule. It has a glans, which is a head portion, and also a hood over it, which is called the prepuce. It's the hoods, it covers the glans. And it is the counterpart to the penis. So if you were a male or female who wanted to be a male, this is what they would do to create the penis, as far as I understand. Perineum is going to be a diamond-shaped region between the pubic arches and the coccyx, and you can kind of see it in this, wrong way, this picture here. Perineum is going to be this area around here. Perineum is a diamond-shaped region between the pubic arch and the coccyx. It's bordered laterally by the ischial tuberosities, and that pretty much tells you all of the parts that you can see here. In this particular picture, you can kind of see the anus, then you're going to have the labia majora. The labia minora is going to be internal to the majora. You can see the clitoris going, and here's the mons pubis that they didn't label in that particular one. Mammary glands also are going to be something that you'll have to identify. And a mammary gland is a modified sweat gland consisting of about 15 to 25 lobes. Its function is to produce milk under certain conditions. There is going to be a nipple that's going to be usually in the center of the mammary gland or breast, and an areola is a pigmented area around the nipple. So when we get to that picture here, you can kind of see that. Here is the nipple, here in the center, and the nipple has multiple openings. So years ago when I was a kid, the nipples that you would get from Gerber only had one opening. They have now modified that for modern kids, and so it's going to be each one of these openings is going to be able to secrete milk under certain conditions. So what would happen down here, or somewhere it says, the little circles here are the alveoli. The alveoli are going to secrete milk or produce milk. And so as they come down this lactiferous duct here, they're going to be stored a little bit in this lactiferous sinus. And under certain conditions, particularly when a baby is nursing, the baby is going to suck on the nipple and release the milk that has been manufactured in this lobe, and then stored here. So certain times, particularly if you're nursing a child and the baby cries, you are going to have a letdown of milk. It's called a milk letdown, and it's going to cause an engorgement around the nipple area. And it's just getting ready for the little baby to suck on the nipple in order to extract the milk from mom. You can notice on some of these pictures here is the breast tissue, and the breast tissue is going to have a lot of adipose tissue throughout it, but it's also going to have these lobes, and the lobes are going to have within them the alveoli that secrete the milk, and the milk will go down this lactiferous duct to the lactiferous sinus to these openings that are going to be in the nipple, and that's how the baby would get their milk. So the purpose of a lactating mother is to provide nourishment for their child. So milk will go down the lactiferous duct to the lactiferous sinuses and open to the outside world at the nipple. The breast size is due to the amount of fat deposits in it. It really does not matter outside of being able to produce milk for the child. Breast cancer is another thing that women are concerned about. Invasive breast cancer is the most common cause of malignancy and the second most common cause of cancer death in United States women. 13% of women will develop that. Breast cancer does have risk factors. One of them, as I'm reading through this, is early onset of menstruation and a late menopause. The other one is no pregnancies or first pregnancies late in life, no or short period of breastfeeding, and or a family history of breast cancer. Unfortunately, 70% of women that end up getting breast cancer have no known risks at all. And so A lot of it is due to mutations in genes called BRCA1 and 2. So 10% of them are hereditary defects. There's not much you can do about that, but you can worry about or be concerned about 50 to 80% will develop breast cancer. So a greater risk of ovarian cancer as well. So if you're following People magazine, and of course I know you are, there is a famous actress who had a family history of breast cancer, and so she had, when she had children afterwards, she had her breast removed. And she also had her uterus removed because she was done having kids. So in her particular case, she has brought her risk of getting breast cancer down to almost zero because she doesn't have any breast tissue and she doesn't have any uterus to worry about. Let's see. So here is the events of oogenesis. You are making the egg, and if you follow it here on the right side, the primary follicle will then become a primordial follicle, which will then get more cells around it, and that's a secondary follicle, which will then go and become a vesicular follicle. And at that particular point, you can see the egg, and you can see the smiling of the happy clown face. That's an antrum, and the antrum is going to release the egg. And if that happens, the egg may end up allowing the woman to be pregnant. If it doesn't, it's going to develop into a scar tissue, and that's called a corpus luteum. And that's what most women have on the surface of their ovaries, is a lot of scar tissue from not getting pregnant. So the ovarian cycle is a monthly cycle of a follicular phase. That's 1 to 14 days. And that's with a 28-day cycle. Ovulation occurs at mid-cycle, and then there's a luteal phase where they're going to rebuild the lining of the uterus again. So the ovarian cycle, only about 10 to 15% of women have a 28-day cycle, but it's just easy to explain it as having a 28-day cycle. And then they go through the whole series of this. This picture kind of shows it. Primordial to primary to secondary. Secondary is a little bit bigger. Late secondary, and you're starting to develop this antrum. And when you get down here, here is the ovum or the egg, and here is the happy smiling clown face. When the antrum releases its contents, which is going to be the egg, this is going to be the rupture of it. And so in that particular case, ovulation has occurred. The oocyte or egg at this particular point is going to get captured by the fallopian tubes at the fimbria. And so you go through this whole cycle. And then if you didn't get pregnant, you were going to end up developing this. So this portion right here would be responsible for maintaining the fetus if that happened. And most of the time it doesn't. Every month, you don't want to get pregnant every month. It is going to turn into a scar tissue, which is called the corpus albicans. So that's what most people are going to have more so than anything else, is the corpus albicans, the scar tissue on their ovaries. And for some women, you're going to feel a twinge of pain sometimes at ovulation, and it's called Mittelschmerz. Just a name that you don't have to worry about. I'm not going to ask you about it, but if you do have, like I know I'm ovulating, it is called Mittelschmerz, which is in the middle of your cycle. And what does it say here? If no pregnancy, the corpus luteum degenerates into something called corpus albicans, and that is a scar in 10 days. If pregnancy does occur, the corpus luteum will produce hormones that sustain pregnancy until the placenta takes over at about 3 months. And that's the end of the female reproductive system.